Hi, everyone. Brian Harris, Consulting Director at Blacktree Healthcare Consulting here. There is a flurry of regulatory activity in home health late on Thursday and into early Friday. I want to give you a high level breakdown of that now as we dive into these updates in a little bit more detail. On the review choice demonstration front, or RCD as we know it, the phase in period for North Carolina and Florida has been extended through January 1st of 2021, when it was originally supposed to end at the end of October. This gives providers in those states a little bit more flexibility to get their operations and billing practices up and running under RCD. In other big news, the home health final rule was released, and with that comes a 1.9% increase in the base rate for PDGM claims. That'll equate to around $390 million in additional spending next year. Definitely good news to see the increase, but it is a little bit lower than what we saw in the proposed rule, which was a 2.6% increase and a $540 million increase in spending. Baked into those rate updates as well is the 4.36% behavioral adjustment that was put into place based off of assumptions CMS made going into PDGM. Despite a lot of advocacy against this, that behavioral adjustment will remain in place as CMS has indicated that they're looking for at least a full year's worth of data in order to make any changes or removal of that behavioral adjustment. Something to look into as there's more advocacy against this going into 2021 for potential rate updates in the future. Probably the biggest operational change is going to be the continued phase out and new rules around the submission of requests for anticipated payment for home health periods of care. Going to 2021, providers will no longer be paid for these RAP submissions, but you'll still be required to submit one for every 30-day period. The billing rules will be relaxed a little bit. Instead of needing the 485 and OASIS completed prior to billing the RAP, you will only need to have that first billable visit completed and the verbal order from the physician. But there will be a 5-day timely filing limit put in place in which all RAPs must be submitted within 5 days of the start of the period. You really want to make sure you're taking a look at your billing practices to ensure these RAPs get out timely and talk with your EMR about what they're doing to prepare for this. One other item of note there is that the HIPS code on the RAP and final claim must still match as per guidance from CMS. Knowing that we won't have the OASIS done typically before submitting the RAP, current guidance is to use dummy HIPS codes on both the RAP and the final in order to make sure they still match, as CMS will use the common working file, diagnoses on the claim, and the OASIS submitted in order to reimburse correctly. Again, we recommend talking with your EMR about how they will have this set up as we adhere to these new RAP guidelines leading into the notice of admission in 2022. A few other updates. Similar to what we saw in the hospice final rule, there will be a rebasing of CBSAs and wage index values going to 2021. Some counties will see an increase in wage index, others will see a decrease, but the final rule does state that there will be a 5% cap in any decreases in the wage index for the year. There were a few interim rules put into place during the COVID-19 pandemic that were finalized with this 2021 rule as well. The first being the use of telecommunications within a patient's care. It was finalized that any provision of remote patient monitoring or any other telecommunications must be stated on the plan of care, and that's very well to use, but you're still not going to see any reimbursement for these at the current moment, and it cannot replace visits in the counting towards LUPAs for Medicare claim submissions. There is currently legislation in Congress to advance this forward and receive reimbursement for telehealth in the future, but as of right now, that is not the case. Another piece that was finalized that was an interim rule under COVID was the allowing of non-physician practitioners to certify home health. You must still abide by state regulations for this, but this has been finalized as allowed under the 2021 final rule from a federal standpoint. Finally, a few smaller items. The home infusion therapy benefit that was included in the 2019 and 2020 final rules will be carried out as expected going into 2021, and minor changes made to the value-based purchasing program in relation to the home health quality reporting exceptions and extensions granted during COVID-19 will be finalized and put in place going into 2021 as well. So definitely a lot of information there. We're diving into this a little bit more ourselves and look to present more information to you all as we proceed. Please feel free to reach out to us with any questions.